In today's culture, being busy seems to be the hip thing. We tend to push sleep aside in order to get more done. And as lupus patients, sleep is vital, but many struggle to sleep due to imbalances in sex hormones, physical discomfort, and adrenal imbalances. Whatever your issues may be, sleep is something we must work to achieve every night. Sleep is when our body is regenerating, repairing, and healing. So let's talk a little bit about stress. People who have lupus generally have excess stress before and after diagnoses. It's the obvious root cause of any disease. How we deal with stress is just as important as whether we have stress or not. Stress is obscure, and most of us know we have stress, but it's not something that's obvious and tangible. Stress can affect your organs, which then affects your hormones. Stress affects your adrenals, thyroid, sex organs, and digestive organs such as the pancreas, stomach, small and large intestines, gallbladder, and the spleen. I believe stress is what caused lupus in me, and it's something that I try to manage as best as I can. So let's talk a little bit about the types and stages of sleep. There are two basic types of sleep. The rapid eye movement, also known as Rem Sleep, and non-Rem sleep, which has 3 different stages. The 3 non-Rem sleep stages are dependent on the brain waves. When sleeping, you cycle through all stages of non-Rem and Rem sleep several times, typically with increasingly longer, deeper Rem periods towards the morning. So stage 1 is defined by the transition from being awake to sleeping. This happens in a short period where you are in relatively light sleep. The heartbeat, breathing, and eye movements are slow and your muscles relax with occasional twitches. This is where your brain waves slow down. Stage 2 is defined by the period of light sleep before you enter deeper sleep. The heartbeat and breathing slows down and muscles relax even further. Your body temperature drops and eye movements stop. The brain waves slow but are marked by brief bursts of electrical activity. This is a stage where most of us spend most of our sleeping. Stage 3 is defined by the period of deep sleep that you need to feel refreshed in the morning. It typically occurs in longer periods during the first half of the night. The heartbeat and breathing slow to their lowest levels, and your muscles are relaxed, and it is at this stage that it is likely difficult to wake you. Let's talk about Rem sleep. This is the rapid eye movement sleep. Typically occurs about 90 minutes after falling asleep. The eyes move rapidly from side to side behind closed eyelids and is characterized by mixed frequency brainwave activity. The breathing becomes faster and irregular, and the heart rate and blood pressure typically increase to near waking levels. This is where the most dreaming occurs, although some can also occur in non-REM sleep. So sleep is essential for rejuvenation, and it is paramount to health, as it is where the body repairs and, as I said, rejuvenates. Although the effect of sleep remains somewhat of a mystery to many, we know that what happens when individuals lack sleep. The productivity goes down, the inflammation goes up, and overall health declines to where one can expect elevated risks for heart disease, kidney disease, stroke, and increased blood pressure. If you have difficult time sleeping, there are many things that you can do to enhance your ability to fall asleep. This includes taking supplements like melatonin, magnesium, valerian, and hops extracts. If you need assistance with supplements, please email info@lupusrebel.com for specific formulations. But winding down is in preparation for sleep is also something you can easily do. Nightly rituals such as avoiding stimulating activities including watching TV, exercising, drinking alcohol, or caffeine are simple things you can avoid. Drinking calming chamomile tea, taking supplements to help you sleep, and taking a bath before going to bed are all things that you can help to do to relax your mind prior to falling asleep. So let's talk a little bit about sleep disturbance. Stressful situations can also alter sleep by affecting our adrenals and thyroid. If you suspect you have some medical imbalances and/or suspect your stress level is affecting the quality of your sleep, it will benefit you to get professional help. We can help you to get to the root of your issues to improve your quality of sleep. It's important to avoid taking medications to sleep, as they can not only be habit forming, but also create dependency and affect the quality of sleep even more. I do hope you enjoyed this blog and understand the importance of sleep. Please subscribe to our YouTube channel, Dr. Connie Jian, and like our Facebook page, Lupus Rebel, and Instagram, as well as follow our Pinterest page, again, Lupus Rebel, to stay in the loop. I'll see you guys next week.